Hello everyone, I'm Jin, the TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for ENT and eye problems for TCM practitioner and acupuncturist. The book we use I put below here. I hope I can help the students to study and review for the class. Let's start. Then we're talking about the symptoms and the signs of the ear. So like people have ear problems. Usually they have some symptoms relationship with the ear. The first symptom is the ear pain. And when people come in with the ear pain, we need to ask some detail about what kind of pain. Then we can make diagnosis with different patterns. We certainly couldn't only by ear pain make the pattern, but gave us some suggestions. Like people slightly ear pain, yes, slightly ear pain. And at the same time, with fever and aversion to cold. So that's we say external passenger evading, yeah, EPI. So that kind of pain usually caused by wind heat. If patients severe kind of ear pain, yes, severe kind of ear pain, pretty sharp, pretty severe, and possible have some yellow kind of discharging, and possible have some emotions and internal heat signs like a bitter taste in the mouth. So that's usually caused by the heat coming from liver and gallbladder and maybe heat combination with the dampness. And if patient long-term slightly ear pain, compare with the first one, slightly ear pain with fever, aversion to cold, usually is acute problem, EPI wind attacking. But it's long-term problem, slightly ear pain, that's usually coming from deficiency. Especially their long-term have some discharging coming from the ear, that's mainly coming from spleen T deficiency and body fluid retention. So that's the first symptom. We're talking about ear pain. Yeah, first symptom we're talking about. The second symptom, we're talking about the pulse coming from the ear. Yeah, pulse coming from the ear. Yeah, some discharging pulse coming from the ear. So this kind of discharging pulse coming from the ear, it usually coming from excessive heat. So this kind of excessive heat, we say, mainly coming from liver gallbladder heat, like excessive kind of condition, we say, mainly coming from liver gallbladder. And if a big amount, that's we talking about liver gallbladder damp heat. Yeah, damp heat. and the discharging is more clear. It's more clear. And due big amount. Thus, we're talking about dampness caused by spring heat deficiency. And we also have the case clear and thin kind of discharging, but it's scanty amount that's usually coming from kidney disease. Certainly, any kind of pattern we need other symptoms, like a kidney deficiency. We have other symptoms like a lower back soreness and weaker knees and frequent urination. So just gave us suggestions here. We couldn't only by the symptoms, like a local symptom, to make a whole pattern diagnosis. Then another symptoms relationship with the ear is the tinnitus. So tinnitus, usually we will ask about the pitch, low pitch and short time kind of tinnitus, usually caused by wind heat. And suddenly happens and pretty loud sounds in there. That's usually caused by liver heat or liver fat. And long-term kind of tinnitus that's usually caused by deficiency. So sometimes in the book, they usually use a special word, societies kind of trap. It's not loud sounds in there, but continually in there. I think it's searching the sounds, what they look like. So that's usually coming from deficiency. We're talking about liver deficiency and kidney deficiency. Another symptoms relationship with the ear. We're talking about deafness, means hearing decrease. So still, if suddenly happens, suddenly happens, and short term, that's we say some blocking in there, yeah, blocking in there. Usually, it's excessive condition, yeah, excessive condition. If long term, yeah, if long term, usually it's a deficiency condition. So that's the symptoms relationship with the ear. We say we have four mainly symptoms relationship with ear problem, ear pain, discharging or pulse coming from the ear, tinnitus, and deafness. So that's about the common symptoms and the signs of the ear problem.